Now, how we are going to manage high and low level of chloride? First, measure the serum chloride. If it is at the normal level of 96 to 105 millimole per liter, you just monitor and try to preserve the chloride homeostasis as much as possible. If the chloride is going to be high, which is greater than 105 millimole per liter, you go for checking the albumin, arterial blood gas, serum potassium, chloride and bicarbonate ion. And you address the underlying cause like hypotonic fluid loss, hemo concentration, excessive intravenous saline administration, or it might be metabolic acidosis. Always remember, metabolic acidosis go along with hyperchloremia. Now, if the chloride level is low, it is less than 96 millimole per liter, you go for albumin, ABG, serum sodium, potassium and bicarbonate. In addition, you measure the urine chloride also. And if the sodium is normal or increased, your urine chloride is high and there is metabolic alkalosis, it is chloride depletion. Here, you co-administer with acetazolamide with loop diuretics, change to chloride sparing diuretics like acetazolamide or spironolactone, add sodium glucose cotransferase 2 inhibitor or sodium free chloride repletion lies in chloride. In case the sodium is low and your chloride concentration is also low, here it is hemodilution. You go for fluid restriction, increase your loop diuretic, if needed add thiazide also, go for antidiuretic hormone receptor antagonist and electrolyte depletion along with chloride supplementation. This is how you treat an high or low chloride. Now, coming to various terminologies which might be associated with chloride ions. First is physiological electrical neutrality, that is through Stewart approach. Here, what is it? The number of positively charged molecules equals the number of negatively charged molecules. So, your cation, sodium, potassium, magnesium and calcium equals the anion, chloride, lactate and weak acid and the unmeasured anions. Both will be equal and the electrical neutrality will be maintained. This is Stewart approach. Then what is strong ion difference? Strong ion difference is nothing but you take the cation, subtract the anion. You leave the weak acid and the unmeasured anions. The weak acids will be phosphate and albumin, and unmeasured anion, if you add it, approximately it will be around 40 millimoles per liter. What is strong anion gap? Here you take only the cation and subtract it from the anion. Cation minus anion and you add the weak acid also and you leave out the unmeasured anion. Why you have to know about this strong ion difference? Here the chloride is very important. Whenever you talk about chloride, you talk in terms of strong ion difference.